Alright guys, we're going to learn just the very basics about acid-base imbalances. And so if you want to follow along a little bit in your book, we are on page 304 in your book. In order to do ABG interpretation, we actually have to have blood gases. And so this picture is showing a blood gas stick. Typically, a blood gas stick is done in the radial artery, and it is done by a trained respiratory therapist. And so it is not something that nursing does in a usual setting. So it's from an artery, and because of that, the stick has to be held for at least 5 minutes. And it's going to tell us a few things. It's going to tell us what the patient's metabolic status is, how well they're oxygenating, and how well they're ventilating. And it can be an issue. We have to make sure that the patient has good circulation to both the radial and ulnar nerve. So we perform a test, and this test is called the Allen's test. And essentially what you do is you occlude, so you're going to occlude both the radial and ulnar artery, and you're going to watch the hand turn pale, and then you're going to release the ulnar side or the ulnar artery, and hopefully the hand will pink back up. If this is the case, that's considered a positive Allen's test, and that should be documented on the ABGs. The ABGs have to be ran immediately. They are affected by temperature. So if they cannot be ran immediately by the respiratory therapist, it's possible they will need to be placed on ice. Just a few reminders from just basic anatomy and physiology. When we're talking about the pH, we're just talking about the hydrogen ion concentration. So if we have an increase in hydrogen ions, that means there's a decrease in the pH, and this is acidosis, and we've talked about this in class several times. So that's reflected by that pH of less than 7.35 that we've talked about. If you have a decrease in your hydrogen ions concentration, then you have an increased pH or a pH that's over 7.45. Okay, we're going to talk about the different parameters. So first, the PCO2. The PCO2 is considered the respiratory parameter. So the PCO2 is considered the respiratory parameter. So we know that the lungs help maintain a normal pH, right? They do so by getting rid of water and CO2. And so this then directly affects the amount of CO2 that's in the blood, okay? And so this is a reflection of lung ventilation. And we know that the breathing center is actually in the brain, and that it can respond to the changes of the amount of CO2 in the blood by changing the depth and the rate of our respirations. And then we have the renal system, or the metabolic component. The metabolic component is reflected in the bicarb. Okay, so the metabolic component is reflected in the bicarb. And we know that the kidneys, are responsible to reabsorb and conserve bicarb, and that they filter it and then they excrete it. Okay, and so we know that too, this is a parameter that changes more slowly than the respiratory parameter, and that it too directly helps it too can change the pH. pH falls, then we excrete less hydrogen and retain more bicarb, and the same if it happens in the other direction. So we're looking at blood gases. We're thinking about acids release a hydrogen ion, bases bind to hydrogen. Buffers help prevent major changes. They do this by releasing or accepting hydrogen ions. And buffers like to try and keep the body's pH between 7.35 to 7.45, and that's your normal. If we're able to maintain a ratio of 20:1, then we can maintain a normal pH that's between 7.35 and 7.45. So what happens when things get out of whack? Well, the opposite system tries to help out. So for instance, if the lungs are struggling, it's a primary respiratory issue, the kidneys will try and help. If it is a kidney issue, the kidney is the primary issue, then the lungs will try and help out. The lungs help out, they compensate for the disturbance by changing the respiratory depth and rate. This compensation occurs much quicker than the kidneys do, but it's also exhausted easier. The kidneys help to kind of control things by acting as a bigger buffer, making the urine more acidic or alkaline. But this particular buffer works slowly, so it doesn't happen as quickly as a change, for instance, as the lungs can produce, but it is more effective. These are your normal values. These are the normal values that I put here on this chart. Let me look on page 306. Those are the normal values, and I think we're pretty good. 735 to 745, PCO2 35 to 45, PO2 80 to 100, bicarb 22 to 26. You don't have to know the base excess, and then O2 sat, your book is saying greater than 95. So this, we're going to actually say is 95% because that's what's in your book, and that is on page 306. Okay, how to interpret blood gases. Listen, you guys have to memorize the normal values, obviously, and a lot of times you just need to use them, and they'll become quicker to recall, okay? And then you just have to understand, a low pH, acidosis. A low pH is acidosis. So you have to think about that. Low pH, less than 735, acidosis. High pH, greater than 745, alkalosis. And then we move on. Once we determine the primary disturbance, do we have acidosis? Do we have alkalosis? Then we move on to identify the primary issue. Okay, so these are your 4 primary disturbances. So remember that when you have a respiratory, or when you have an acidosis, it's less than 735. So look, for both metabolic and respiratory, the acidosis pH is less than 735. But then let's say that you looked next at your PCO2 and it was greater than 45. Well, if that's the case, your PCO2 is abnormal, then you make your arrow go up because it's increased, and this is respiratory acidosis. You have a decreased pH, but an increased PCO2. Arrows go in the opposite direction. But let's say that you looked at your pH and it was less than 735. You looked at your PCO2 and it was normal. It was within that 35 to 45 range. And you looked at your bicarb and it was less than 22. Well, then you have a primary disturbance of metabolic acidosis. In metabolic acidosis, in metabolic conditions, your arrows go in the same direction. Alkalosis is that pH greater than 745, whether it be metabolic or respiratory. But let's say that our pH was 748, so we knew it was elevated. And then we looked and our PCO2 was only 30, and it was low. And we know it's a primary respiratory disturbance because our arrows are opposite. And for metabolic alkalosis, if the pH is greater than 745, it would be an up arrow, and the PCO2 would be greater than 26, and it would be an up arrow. A lot of people use the acronym ROME. Respiratory, opposite, metabolic, equal. Meaning the arrows in respiratory go opposite of each other, but in metabolic, they're equal or go in the same direction. We're not going to talk a lot about compensation. You guys will get into what we call uncompensated, partially compensated, or compensated. But just know that as soon as the pH is abnormal, and it's like, for instance, a primary respiratory issue, then what happens is the kidneys will try to move or change this condition. And the same happens if it's a renal condition. The lungs will try to move and change this condition by affecting the rate and depth of the respirations. And so you don't really have to know much about this slide, but just realize you're learning the basics of what we are going to call uncompensated blood gases, knowing that in MP4 you're going to learn about partially and fully compensated. Just a little refresher, this is showing you on a scale of where we like to be. We like to be between 735 to 745, and we accomplish this by having 20 bicarbs to 1 carbonic acid. When this is not the case, then our ratio is not maintained and our pH will fall out of normal range.